Buen día a todas y
Good
todos y
morning to
bienvenidos
everyone
a esta
and
sesión
welcome to
virtual de
this
prensa de la
virtual press
Organización
briefing
Panamericana de la Salud.
by the Pan American
Soy
Health
Ashley Bullring del
Organization. My name
Departamento de
is Ashley Bullrin
Comunicaciones de
with the
aquí en la
Communications
OPS.
Department here at
Hoy
PAHO.
vamos a hablar del
Today,
costo
we will be
económico de la
discussing the
higiene
economic
y la salud
cost of the
mental. A partir
non-communicable
del informe,
diseases
una
and
gran
mental health
tormenta acecha
from
en el
this
horizonte.
report
Las cargas
that was just
macroeconómicas y de
published.
salud de las enfermedades no transmisibles y los problemas de salud mental en América del
Major
Sur,
storm on the horizon, health and
encargado
macroeconomic
por la
burdens of
OPS y
non-communicable diseases and
elaborado por
mental health conditions
investigadores
in
de la
South
Escuela
America that
de Salud
was
Pública
commissioned by
de
PAHO
H. Chan
and that
de
it
la
was
Universidad de
produced
Harvard.
by H. Chan
Estoy
Medical
acompañada aquí en la sede
School,
de la OPS
Harvard
en Washington,
professors.
D.C.
Here I
por el
am
doctor Barbas
in
Barbosa,
Washington,
director
D.C. with
de
the
la
director
OPS,
Barbas Barbosa,
Silvana
director of PAHO,
Luciani, jefa
Silvana
de la unidad
Luciani,
de
who is
enfermedades
the
no
unit chief for
transmisibles de la OPS,
non-communicable diseases with
y
PAHO,
Matías
and
Irazabal,
Matias
asesor regional en
Razabal,
salud
who is
mental
the
de la
regional
OPS,
advisor on
quien se
mental health
conecta
with
de
PAHO, who
forma
is
virtual.
connecting virtually.
También estaremos acompañados a través de un
We
video
will
por el
also
doctor David
have
E.
Dr.
Bloom,
David E.
profesor de
Bloom,
Economía
who
y
is an economics
Demografía en la
professor and
Escuela de Salud
demographics
Pública
professor with the
G.H. Chan de
Public
Harvard
Health
e
School
investigador
from Chi
principal del
Chan
informe,
School in Harvard, who
quien
is the main
lamentablemente
researcher
tuvo un inconveniente
for the
personal
report.
y no
He
podrá
had a
conectarse al
personal
video.
issue and he was
En vivo,
unable
perdón.
to
Y
connect live,
también
so
nos
we will have
acompaña
his video. And we
virtualmente
also have
Madalena Ferrana,
Madalena
profesora
Ferrana, who is
asistente en
connected
el
virtually,
Departamento
who
de
is an
Economía
independent
Farmacéutica
advisor on
y de la Salud
pharmaceuticals,
de
on the
la
pharmaceutical
Universidad del
department
Sur
and
de
health
California
with
en los
the
Estados Unidos y
University
quien fue
of
investigadora
South California,
asociada
and
en
who
la
was
Escuela de
also an
Salud
associate
Pública G.H.
researcher
Chan de
in
Harvard
the public
durante
health
la
school
elaboración de
of
esta
Harvard
investigación.
during the development of
Durante
this
la sesión
research.
pueden hacer
During the
preguntas en
session, you
vivo
will be
levantando la
able
mano
to
o
ask
utilizando
questions
el
live by
botón
raising
Chat.
the virtual
Les
hand and
pedimos
also by
que
using
se
the Q&A
identifiquen
button.
en el
Please
video con
identify
su
yourselves
nombre
in
y
the
medio de
Q&A
comunicación
by
al que
stating your
representan.
media outlet
Contamos
and your
con
name.
traducción
We also
simultánea
have
en
simultaneous
inglés,
interpretation into
español,
English, Spanish,
francés y
French, and
portugués.
Portuguese.
Ahora cedo la
Now,
palabra al
I
doctor
give the
Barbosa
floor
para
to
sus
Dr.
palabras de
Barbosa
apertura.
for his opening remarks.
Gracias, Ashley.
I
Buenos
thank
días
you,
a
Ashley.
todas y
Good
todos.
morning
Gracias
to
por
all of you,
acompañarnos en
and
esta
good
rueda de
morning
prensa
for
virtual.
being with
Con
us
demasiada
here
frecuencia
in this
pensamos en la
press
salud
briefing.
en
Too
términos
often we think
limitados,
about health
pero la
in
buena
narrow
salud no
terms,
solo
but
es
good
vital
health
para las
is not only
personas,
vital for
es un motor
individuals, it
poderoso
is a
para la
powerful
seguridad, el
engine for
crecimiento económico,
security,
el
economic
desarrollo
growth,
social y la
societal
prosperidad.
development, and
Impacta
prosperity.
en
It
nuestras
impacts
economías,
our
nuestras
economies,
comunidades y
our
nuestro futuro
communities, and
colectivo.
our collective future.
Hoy presentamos un
Today,
nuevo
we are
informe de la
launching a
Organización
new
Panamericana de la
PAHO
Salud,
report
una gran tormenta acecha en el horizonte, elaborado en
entitled
colaboración con la Escuela de Salud Pública de la Universidad de Harvard, que deja clara esa conexión. Los hallazgos
Major Storm on the
son
Horizon. This
contundentes.
was developed
Entre
together with
2020 y
the
2050 se proyecta
School
que las
of
enfermedades
Harvard,
no
and the
transmisibles
conclusions
y los
are stark.
trastornos de salud
Between
mental
2020 and
causarán a
2050,
Sudamérica
non-communicable diseases
más
or
de
NCDs and mental health
7,6
conditions are
billones de
projected to
dólares
cost
en
South
pérdidas
America
de
more than
productividad
7.3
y
trillion
gastos
US
en
dollars
atención
in
médica.
lost productivity and
Eso
healthcare
se debe
spending. That
principalmente a
is
muertes
primarily due
prematuras,
to premature deaths,
discapacidades y menor
disability,
participación
and
en la fuerza
reduced
laboral.
workforce
Para
participation.
ponerlo en
To
perspectiva,
put it in
es lo
perspective,
equivalente a todo el
that
Producto
is
Interno
equivalent to
Bruto
the
anual de
entire
toda
annual
América Latina y
GDP of
América,
Latin America and the
desviado por
Caribbean,
condiciones que se
lost
pueden
to
prevenir
preventable
o tratar.
and treatable
No es
conditions.
una cifra abstracta.
This is not an
Se
abstract
proyectan
figure.
pérdidas
This
económicas
project,
enormes
massive
que van
economic
desde
losses for
los
countries,
88
range
mil
from
millones de
88
dólares en Uruguay
billion in
hasta
Uruguay to
3,7 billones en Brasil.
3.7 trillion
En
in
algunos
Brazil.
países,
In some
eso
countries,
representa hasta
this is equivalent to
4,5%
up to
del PIB.
4.5 of the GDP.
Essas não são solo
These are
estatísticas de
not
salud,
just
são
health
cenários de
statistics.
alerta fiscal.
These are fiscal
Essa não é solo outra crise
alarm
de saúde. La creciente carga
bell
de las
situations.
enfermedades no
This is not just
transmisibles y
another
las
health
afecciones de
crisis.
salud
The
mental
escalating burden of
se ha convertido en una
NCDs and
emergencia
mental health
económica,
conditions
quizás el
has
mayor
become an
desastre
econnomic
económico en
emergency,
salud.
perhaps the worst
Las
economic
personas
disaster
que
in
viven con
health.
enfermedades
People living with
cardiovasculares,
cardiovascular diseases, cancer, diabetes, and chronic respiratory conditions are at the heart of this storm. Even though the report focuses on South America, its message rings true for the entire region and the world. The latest information shows us that NCD are the leading cause of death in the Americas, claiming 6 million lives in 2021. Nearly 40% of those losses occur prematurely, that is, among people under the age of 70. Cardiovascular diseases and cancer alone account for more than half of those deaths. Meanwhile, diabetes is rising. An estimated 43 million people with diabetes are unable to have access to the treatment they need. Mental health conditions are also increasing, which creates further problems to health systems and productivity. This rising prevalence of NCDs is driven by aging and exposure to risk factors. Today, 240 million people in the Americas live with an NCD, and all of them need continuous, affordable, quality care, starting at the primary care level. The good news is that many of those conditions are preventable. The main risk factors, tobacco use, unhealthy diets, lack of physical activity, harmful alcohol use, and air pollution can all be addressed. And the trends are concerning. Since 2000, adult obesity in the region has increased by 67.5%, diabetes by 53.6%, and physical inactivity by 24.1%. About 67.5% of adults in the Americas are overweight, well above the global average of 43.5%. And the region also has the highest levels of physical inactivity, 35.6% compared to 31.3% globally. Risk reduction is both urgent and essential. We know that with the right investment, it is possible to make progress. Now I will switch to English.
Since 2000, cardiovascular and cancer mortality have declined significantly thanks to policy and innovation. The Pan American Healthy Hearts Initiative, now implemented in 33 countries, has helped over 5.7 million people manage hypertension through primary health care. Healthy diets and regular physical activities are medicine against NCDs. We can prevent up to 40% of cancers by reducing tobacco use, improving diets, and promoting active lifestyles. And we can eliminate cervical cancer with vaccines, early screening, and treatment of precancerous lesions. Second, early diagnosis and access to treatment save lives and strengthen economies. Health systems that detect risk early and act swiftly improve not just survival, but economic growth and wellness. PAHO is helping countries expand access to essential medicines and diagnostics, strengthen their health systems, and improve data through our Better Care for NCDs initiative. Our revolving funds, PAHO's procurement mechanism for the region of the Americas, are also enabling equitable access to diagnostics, HPV vaccines, and NCD treatments. But we must go further. Only 36% of people with hypertension have it controlled, and 57.7% of people with diabetes are receiving treatment. Third, the world is waking up to the threat of NCDs. This September, during the United Nations General Assembly, the fourth UN high-level meeting on NCDs and mental health, we offer a pivotal opportunity to take action. Government, civil society, academia, and the private sector will come together to renew global commitments and adopt a new political declaration to reduce premature deaths from NCDs and promote mental well-being. PAHO is supporting our member states with technical guidance, regional consultation, and a new collection of best practices. We also need financing solutions. National health budgets must prioritize NCDs and mental health. And fiscal policies like excise taxes on tobacco, alcohol, and sugary beverages can fund reforms while improving public health. Health is the foundation of development, security, and prosperity. And while the challenge is great, the window for action is wide open. Tackling NCDs and improving mental health gives us a clear path to a better future, but it requires bold, coordinated, and data-driven policy. So today, I urge all governments, partners, and communities. Make health central to your economic strategies. Promote healthy lifestyles. Strengthen fiscal and regulatory policies to address key risk factors. Invest in primary health care. And expand mental health services. The report we launched today underscores what's at stake. Trillions of dollars in economic losses and countless lives. The time to act is now. Thank you.
Muchas gracias, Dr. Barbosa.
Thank you very much, Dr. Barbosa. We have already shared the link to the reports via chat, and please remember that you can use the Q&A button to send your questions or raising your hand. Now we are going to have a brief presentation, a brief video by Professor David E. Bloom, who is the main researcher behind the report.
Thank you, Dr. Barbosa. It's a great pleasure to have this opportunity to offer some comments on the new PAHO report. To help inform this session, I'd like to spotlight three key premises that motivated the preparation and structure of the PAHO report. The first premise has to do with the distinction between intrinsic and instrumental value. Second premise has to do with the link between burdens and benefits. And the third premise has to do with the virtues of evidence-based priority setting. With regard to the first premise, I'd like to observe that policymakers in South America and beyond have for many decades tended to undervalue health. Health has been undervalued because the valuation concept applied to health has routinely been limited to intrinsic value. But increasingly, the world has come to understand that health also has instrumental value. To be more precise, health has intrinsic value because of the inherent satisfaction or enjoyment people get from having longer and healthier lives. Good health also has instrumental value that is rooted in the ability of healthy people to work more productively, and to conserve their savings, thereby promoting higher levels of productive investment in physical capital, human capital, and new knowledge, and stronger macroeconomic performance. I would also note here that there's now a considerable body of academic literature in the fields of public health, health economics, and development economics pointing to the fact that the instrumental value of health is considerable in magnitude. The second key premise underlying the new PAHO report relates to the logical connection between the burdens of ill health and the benefits of health interventions. Understanding and monetizing the burdens of ill health are important because they're the flip side of the benefits of interventions aimed at addressing those burdens. In other words, if you neglect the macroeconomic burdens of ill health, you'll necessarily give short shrift to the macroeconomic benefits of health-focused interventions. That will in turn weaken the case for such interventions, and that's precisely the pitfall the PAHO report seeks to avoid. A third premise of the PAHO report has to do with the importance of evidence to priority setting. Along these lines, one goal of ministers of finance and ministers of planning is to establish priorities across sectors. They do that by deciding how much resources should be allocated to the health sector, as opposed to other sectors like infrastructure development, national defense, and education. By contrast, one goal of ministers of health is to establish priorities within the health sector, which they do by deciding how much resources should be allocated to different health interventions. And by the way, when I speak about interventions here, I'm speaking about interventions writ large, encompassing everything from vaccines and pharmaceutical drugs, to diagnostics, medical devices and procedures, to programs that focus on reducing unhealthy diets, physical inactivity, and the consumption of tobacco and alcohol, to health systems that emphasize quality and people-centered primary health care and universal health coverage. Ideally, national and sectoral priorities will be evidence-based and rational in two senses. First, that the overall health budget reflects, in the interest of efficiency, the full value of health relative to non-health uses of public monies. And second, that the health budget itself is allocated to those health interventions that can be expected to deliver the most benefits per unit of cost. And this is true whether we're talking about an intervention aimed at disease prevention, early detection, treatment, care, health-related R&D, or systemic strengthening. In this spirit, a key goal of the PAHO report is to equip PAHO and South American policymakers with evidence that will reliably put them in a position to advance the needle appreciably and justifiably on the priority given to large transformative increases in health sector budgets, and also to the rational allocation of those budgets among competing uses. In other words, the PAHO report is aimed at helping ministers of health express and advocate for their priorities in terms that are understandable to and that align most closely with the interests of ministers of finance and planning and other policymakers who hold the power of the purse. The PAHO report is also aimed at helping economics ministers make grounded and judicious decisions about health sector budgets. In closing, I would compliment PAHO on the timeliness of its report given the widespread occurrence and rapid pace of population aging in South America. The PAHO report is also timely given the vulnerability of older people to a multiplicity of daunting health challenges, including those associated with climate change, environmental degradation, and the growing prevalence of crowded living conditions and ultra-processed food consumption. Thank you all for indulging my virtual presence. I'll stop here and leave it to my colleague, Professor Madalena Farana, to answer your questions.
Many thanks, Professor Bloom. We're now going to go to some of the questions that we've received in anticipation of the press briefing. The first is from Blanca Valadez from Grupo Milenio de Mexico. I can see that you're connected live. I don't know if you want to ask your question live, Blanca, but let me know in the next 5 seconds if you do. Okay, si no, lo leo.
Otherwise, I will be reading it. What is the situation that prevails in Mexico? Everything indicates that there has been a severe setback in the control of the NCTs, and the morbidity and mortality have increased. Do you have any project with Mexico to combat NCTs? I thank you. Good morning to all of you. Blanca, that is an excellent question. Even though Mexico is not part of this report that we are launching today, from PAHO, we are indeed publishing data and reports. We just published another report that is called NCTs and a listing that includes all of the mortality and morbidity data based on the countries in the Americas in terms of non-communicable diseases and also their risk factors. And the situation is similar in other countries. 7 out of 10 deaths are due to a non-communicable disease, and the main causes of those non-communicable diseases in Mexico are similar to the ones in other regions, that is to say, heart disease, diabetes, and cancer. And the mortality rates, even though in Mexico we are seeing an increase, are similar to the one that we see in other countries. So the situation is similar. We see a similar increase in the rate of mortality and the main causes. But in Mexico, we might be seeing a situation that is different from other countries, and it has to do with diabetes. The rates of diabetes and the mortality due to diabetes are increasing, and they are almost 3 times higher than the one that we have in other countries of the region. So diabetes is a very severe problem in Mexico. Now, PAHO is working closely with the government, with the Ministry of Health, ISTE, and civil society. Mexico has a very strong civil society that is fighting against NCDs, and PAHO is strengthening the prevention policies and also the policies to reduce risk. Over the last couple of years, Mexico has also been able to make great progress in terms of prevention. There is a frontal labeling in the case of tobacco that informs, for example, consumers of tobacco and also other products that have high content of trans fat and high sugar content. There is legislation that has been passed to eliminate trans fat, which is key for heart disease. And also by eliminating trans fat, we can also reduce mortality due to heart diseases. And there is also a tax on sugary beverages, and this is a very important initiative. This is a tax on sugary beverages, not only to reduce the consumption of this type of beverages, but also to increase the budget that can be reinvested in health. But in addition to the prevention policies, we also have many initiatives to improve the treatment of individuals that live with a non-communicable disease as part of the primary care that we offer, and also by increasing the number of individuals that are diagnosed, controlled, and treated due to hypertension under the Hearts Initiative. And in Mexico, this is being implemented in about 500 health clinics. We are training health professionals. We're also using standards and also having access to high-quality medicines. And also in the case of diabetes, we are implementing clinical paths to be able to standardize the care of people with diabetes. And I would like to conclude by saying that as journalists, you have a very important role in this fight against non-communicable diseases, and also to increase knowledge among the public, but also to make sure that the policies do have the support of the government and the public to be able to be implemented, and also for the health centers to expand access and quality of services for those individuals who have NCDs. I thank you, Ashley. Thank you. And just to add to what you said and to call your attention to a program that is supporting PAHO with the government of Mexico. This was launched by the president, Claudia Sheinbaum, and this is called a program that goes house after house, and the idea is to send health professionals to these to the homes of the elderly, and oftentimes, given the medical care and medical appointments that they may have, they are not in a situation to go to those medical centers. So this is a very important initiative. The other countries in the region do have similar initiatives, but we think that this may have a very important role to reduce the access barriers that we see for the elderly, mainly in rural areas and in communities that are more remote, individuals who are in vulnerable situations from the social and economic point of view, and also to guarantee that those individuals have access to diagnosis, treatment, and ongoing monitoring of diabetes, hypertension, and also NCDs in general. So we are having conversations with the administration of Mexico so that this new experience that is being implemented by Mexico be part of a panel to be addressed at the General Assembly that the UN will have in September in New York. I thank you, Dr. Barbosa. I thank you, Silvana. Now we have a question by Daniel Colin from TN23, Guatemala, and he's asking, taking as a point of reference this report, what is your outlook on mental health in Guatemala, and what is the social, medical, and economic cost that this could represent? I don't know whether Matias would like to start answering this question.
Thank you very much for your question and good morning, everyone. Although Guatemala is not included in the report, and I am very enthusiastic that there are countries that are not in the report but want to learn more. We have very relevant information based on of what we have in PAHO regarding mental health and NCDs. In Guatemala, according to our recent reports, 6.2% is the number for suicide per 100,000 inhabitants. So these deaths could have been prevented if prevention had been put in place. So sometimes we have a situation where these diseases are invisible. People with mental health are sometimes now taken care of, but many times people who have NCDs die because they have also depression, and therefore this leads to suicide. The economic cost is devastating for Guatemala and the rest of the region. We estimate that in Guatemala, we could have been losing about 4% of the PIB due to untreated mental health situation. The money that is lost because there's less productivity and avoidable medical expenses, most of which are out of pocket. I think the key is integrating everything. We cannot continue to treat mental health separated from NCDs. When someone comes in with diabetes, we need to evaluate their mental status. If we need to do a mental health assessment together with trying to control their blood sugar and insulin levels. The initiative for better care for NCDs for the whole region, thanks to the emphasis given by our director, we are trying to include mental health services for primary health care. There is also a strategic program to give direct orientation and training for considering mental health for each one of the countries and subregions of the Americas. We also have a regional strategy to prevent suicide, a regional policy on on mental health. In the last General Assembly of the United Nations, mental health was included very relevantly. This all shows that we can invest more in mental health, that every dollar invested generates at least $4 in additional benefits. So the question is not whether the countries can afford to invest in mental health, but the question is, can they afford not to do it? Thank you. Thank you very much, Matias. And now we go to a question live from Mauricio Torres from CNN. Hello, good morning. I have two questions. First is whether the governments of the countries, the 10 countries included in the report, were contacted to be made aware of the information and projections that are included here in the report. Is this a big call to action for the region in South America? The second question is related to the chapter or the part including the recommended strategies for the countries to adopt these strategies so that they confront the situation. And I think these are broad questions, and the report emphasizes that policies can be implemented separately or altogether. But my question is, out of these, are there some more urgent than others? For example, improving primary health care, or if there is one which should be the first and foremost priority? That's my question, or my two questions. Thank you very much. Dr. Barbosa or Silvana, yes, thank you very much for your question regarding consulting with the governments. Well, yes, we have done it through the broad diffusion of this report before this briefing to report the countries. And these are data that are available publicly. They were used for the report to run these estimates, not only about the burden of disease, but also the impact on the economy and the costs that are related to diseases and the loss in labor force. Regarding the second question, in terms of the list of recommendations and interventions, yes, this is all based on what is called the best buys. In other words, the best interventions that are cost effective for preventing and controlling non-communicable diseases, NCDs. So they are a whole set of policies to reduce risk factors for tobacco consumption, damaging use of health to promote of alcohol, promoting physical health and a healthy diet. But it also includes the whole package of primary health care to diagnose and treat people with hypertension, diabetes, asthma, and other respiratory diseases that are chronic, as well as for screening and treating for cancer. So we have 16 total interventions, which are the most cost effective. Economic analyses have been run that assess the cost of implementing these interventions, which is around $1.50 to $3, depending on the country. This is the cost of implementing, but what is important, and that's why they're cost effective. It's because it's the return on investment per every dollar invested in these tests or in these 16 interventions. The return is of $2 to $3 depending on the country. So this is a set of recommendations that we want people to put in practice because they're both good return on investment, cost effective. But if you have to prioritize what we recommend from PAHO, and what we are doing, working with the government as we go, is doing assessments based on evidence of cost effectiveness and the acceptability in terms of implementing and how we can provide primary health care services. So that is my answer for now. Thank you. Thank you. Now, Dr. Barbosa, over to you. Yes, I just would like to supplement, although Silvana's response was very all-encompassing, but for NCDs, according to the report says, it is a problem today, and NCDs will continue to be an increasing problem as years go by, because in the region of Latin America and the Caribbean, we have the fastest demographic transition in the whole world. So what is recommended always is we need to first look at protecting future generations, prevention. And as Silvana mentioned, there are very effective interventions that many countries in the region are already implementing, like the front labeling of products in terms of giving the content of salt, sugar, fats, also excise taxes on sugary drinks, tobacco. And there are all these international agreements to reduce the use of tobacco, the harmful use of alcohol, and also working with the education sector and others to promote physical activity and healthy diets. But at the same time, we need to respond to the burden of disease today. One of the big problems we have is the lack of preparation of primary health care centers to do early diagnosis and offer treatment and monitoring and controlling. In countries who have not implemented the heart initiative, which we already mentioned too, the percentage of people with hypertension who have hypertension control could be very low, up to only 25%. But countries that have implemented hearts in the region who have already implemented hearts almost 100% in their healthcare networks, the percentage can go up to more than 60%. So the benefit is immediate, and immediate impact on preventable and premature deaths that are a big social and economic problem, in addition to there being a health problem too. Thank you, Dr. Barbosa and Silvana. Now we're going to ask a question which we received from Germaine Abel. She is a journalist from St. Kitts and Nevis.
NCDs continue to be a challenge. What is the impact on the region? And then should there be a ban or tax on sugary beverages in the region? So I wonder if we'll go to Madalena first of all for the first part of the question, and then we can come back to Silvana or Dr. Barbosa afterwards. Thank you.
Yes, thank you, Ashley, and thank you, Jermaine, sorry, for the question. So unfortunately, the Caribbean region was not in the report, and I don't have specific data about the region or St. Kitts and Nevis. But what I can say is that we can expect probably similar burdens, economic burdens, in the region and in the island in particular, compared to what we estimated for the other South American countries. And the reason is because similar risk factors are shared across all these countries. So aging of the population, the increased impact of NCDs, the negative impact of NCDs on labor force participation, on disabilities, the healthcare systems of the Caribbean region, they share similar characteristics as the countries that we consider in the report. So without speculating too much, I expect similar sizes in terms of burden and projections of the burden in the future. Yeah, I think I can just stop here. Thank you for the question.
Thank you very much, Silvana.
Sure. Thank you, Jermaine, for the question. And the Caribbean does have a much higher NCD burden as compared to the other subregions in the Americas. And in terms of St. Kitts and Nevis, I just looked at the ranking in terms of mortality rates, and it's quite high. It's in the top 5 rankings. And a lot of it has to do with the higher rates of obesity and diabetes and hypertension. So in St. Kitts and Nevis, about a quarter of the population has obesity, about a fifth has diabetes, and about a quarter with hypertension. Again, really calling attention to the need to expand access to those primary care services and provide diagnosis, treatment, and control to prevent some of those deaths and prevent some of the early deaths in the population that is at high risk. But I would say also some of the policies, some of the prevention policies also need to be improved. And you raised the point about sugar-sweetened beverage taxes, and that has proven to be a very effective policy to reduce consumption of sugar-sweetened beverages. In the Caribbean, we've seen, for example, in Barbados, that was one of the early adopters of sugar-sweetened beverage taxes, where consumption has been reduced. And it's also, again, a way to help improve the health budget and reinvest some of the funding that is generated from these health taxes back into health programs. So thank you again for the question.
Thank you very much, Silvana and Madalena. We have another question from Manuel Lino Gonzalez, who wants to know about los países de América Central.
The countries in Central America are not included in this report, but we are countries that have very many similarities to the countries in South America. Do you have special recommendations for us in Central America? Please, Silvana. Yes, thank you very much. Even though Central American countries were not part of this report, as we already know, we have some economic data because other studies have been done of the economic impact in the investment cases. And in Central America, this has been done in Costa Rica, for example. And this was some encouragement to then proceed and do the study in South America. So we do have some data showing the same results, that around 4% of the GDP will be lost in the next 30 years due to the high burden of NCDs and costs for treatment and the loss in the economy due to premature deaths. For Central America, the mortality rates are similar to those observed in other countries in the region. High percentage, between 65 and 70% of all deaths are due to NCDs, with the cardiovascular diseases are the first cause of death, followed by cancer and diabetes. So there are similar recommendations for other countries. And in this report, where there's mention of implementing policies to reduce risk, but also broadening access to medications and services through primary health care services. Let me point something out, which was mentioned by Dr. Barbosa in his opening remarks regarding essential medicines for non-communicable diseases. We know that medicines are perhaps not the first line or the first high percentage of cost in health expenses, but for purchases by the country, we have all the essential medicines for cancer, diabetes, hypertension, which are not as much used, and sometimes the savings are enormous. In other words, there are some cancer medications that can be purchased through the strategic fund, and they have a savings of up to 80% of the price. In other words, one of the recommendations is using the strategic fund, the PAHO strategic fund. Consider using these funds to have access to medications and thus save in health expenses. Thank you. Thank you very much, Silvana. We have another question from Manuel Lino. Do you have any recommendation about the amount or the proportion of the GDP that the country should devote to health with this new approach of joining mental health with physical health? And so what are the recommendations in this case? To you, Dr. Barbosa. Thank you. Well, yes, there are some studies that say that to guarantee a universal access, health system, the countries in the region should invest at least 6% of their GDP as public expenditure in health. And I underline public expenditure. In some places, the health investment is 6% or more, but not in public expenditure. But if we did that, we could offer in the countries systems and universal access. The challenge for the region and the average, the countries are about 4.1% in terms of investment in health. We need to make an effort. We know many countries have difficulties. The fiscal space is reduced, but even this, for example, increasing rates and taxes on alcohol, tobacco, and sugary drinks could also be a benefit for public health because it is an effective measure to reduce consumption of these products and at the same time generate perhaps an alternative source to then fund the health system. So we are working with countries in the region to look for alternatives, but we need to make the effort to go beyond 4.1 in terms of public expenditure as a percentage of the GDP to 6%. And out of this 6%, we recommend that 30% of that 6% be invested in primary healthcare, where we have the best chance to treat and respond to mental health problems as well as NCD in general, and be closer that way to the communities with much better quality treatment and care, and offer a better access for most people. Thank you very much. Thank you very much, Dr. Barbosa. Now we have a question regarding Argentina. Argentina appears in the report. And how do you assess the performance of the country based on the data obtained and given the regional context?
So Argentina appears in the report. How do you evaluate the country's performance based on the data collected and in the regional context? Thank you.
Sorry, is it my turn to talk?
Yes, please, if you'd like to start. And then Paco, thank you.
Yeah, yes. So Argentina is in the report, indeed. And as you can see in the report, the burden that we find of NCDs and mental health conditions in Argentina is quite high. So, for example, on figure 5, we find that figure 6, actually, it's better. Like the burden in terms of percent of annual GDP is more than 4%, which is quite a large numbers. And we can compare it to what is typically spent in other measures or in other departments, like in defense or education and so on. So the burden is very high. It's one of the highest in the region, and that is due to different factors. So one factor is the demographics of the population and the aging of the population itself, and how the population is going to be even older in the future. Another factor is the prevalence of NCDs and the importance of some risk factors for NCDs, in particular diabetes and pollution and other factors, and tobacco use, alcohol use, and so on. And other factors that explain the high number, the high figure, has to do with the healthcare system and the cost of treatment for NCDs and mental health conditions, which is one of the highest in the region. Other factors that contribute to the number are concern the working age population and the labor force population, the labor force basically in the country, and how much NCDs and mental health conditions are going to reduce the labor force, and in particular are going to reduce the number of people, of working age people, and also the productivities of people, of the labor force. So all these factors explain the figure that we find in the report for Argentina. And thanks a lot for the question.
Thank you, Madalena. Matías, no sé si tenías algo para agregar sobre salud mental en Argentina.
Matthias, I don't know if you have anything else to add regarding health in Argentina. Yes, thank you, Ashley. Argentina, like other countries in the region, has a specific and very significant problem in terms of mental health, and this increases the economic burden. Mental health problems represent a considerable loss, 4% of the GDP, with high rates of mental health and suicide, which have increased after the pandemic, and the economic impact is reflected in a loss in labor productivity and health care. Many adults are affected, and this affects the economic growth. The most productive age group is very widely affected, and there are high costs, but there are opportunities and actions that are being carried out in the country, which are important. For example, implementing the national health on mental health. This enforcement or this enactment requires a lot of effort by the country also opening and establishing mental health cares, primary health care, awareness campaigns to reduce stigma and other activities related to the mental health initiative, which is the initiative from PAHO's director, where Argentina is participating. There are actions also related to the use of telemedicine for psychiatry, also including mental health assessments during primary health care visit, but also funding for early intervention and detection programs, which Argentina can develop. Argentina has increased funding of up to 10% for mental health care, but we recognize that the distribution of the whole budget needs to be focused more on primary health care yet, as well as on community care. Thank you very much. Thank you very much, Matias. And now I see that a journalist
has her hand raised, so I'll give you the floor. Thank you.
Hi, thank you very much for this briefing. I'm sorry, my audio was going in and out, so forgive me if you've already discussed this, but I was interested in specifically trans fatty acids and their use in the diet and how it can help reduce non-communicable diseases. This came up because the UN put out a draft of a political declaration around non-communicable diseases and called for the elimination of trans fatty acids. And I've seen some pushback, and I just wanted to understand kind of how that fits in this context and report. Thank you so much.
Silvana.
Okay, thanks for the question. It's an excellent question, Gabrielle, and this has been a hot topic for about 10, 15 years now, because the UN high-level meeting on NCDs is happening this year in September, as you've noted, and there's a political declaration being negotiated now. But this is the 4th UN high-level meeting on NCDs, and a lot of the issues that are being negotiated now have been in discussion for the past 14 years, when the first UN high-level meeting took place in 2011. And with the issue of eliminating trans fat from the food supply, it is because it is a best buy, it is cost effective in reducing cardiovascular disease mortality. And in fact, New York City was one of the first areas within the US to ban trans fat, and they started seeing immediately, almost immediately, within the first 2 years after the ban, a reduction in cardiovascular disease mortality. Of course, the reduction is not attributed solely to the elimination of trans fat, and there are multi-factors going into reduction of mortality rates, but eliminating trans fat is one of the WHO best buys, a tremendous amount of evidence. And at PAHO, we have a regional initiative to eliminate trans fat, and some 10 countries have already now passed legislation to eliminate trans fat. And we have a lot of assistance that we're providing to governments on what some of the regulation can look like and how to implement in a way that is acceptable for everyone. Thank you.
No, I just want to compliment, say thank you for this very important question. That it's important also to highlight that the region of the Americas will play a very important role during the UN high-level meeting. We have 2 co-facilitators now that are negotiating with the countries the declaration. One of them is from our region, is the ambassador from St. Vincent and the Grenadines, and we are providing the support. Of course, this is a decision that will be made by the countries. But we are providing technical evidence, we are providing technical documents, and we are facilitating the access of all the countries to the discussion, so they will be well prepared to interfere in the discussions and to facilitate the consensus. This will be a very important moment because the political declaration will renew the commitment, and we will call the attention that not only the health sector, but also, as the report that we present today is highlighting clearly, that this is crucial for the social and economic development of the region. Thank you.
Muchas gracias, doctor Barbosa.
Thank you very much, Dr. Barbosa. Thank you very much, Silvana. We have a final question before we close this session. This question is from Colombia by Sofia Naida, who would like to know about the specific Colombian case and the impact of NCDs, since it has increased due to the crisis that we have in the current health system. What are the projections for Colombians? Silvana? Thank you. Thank you very much for this question. In Colombia, the situation is similar to that of other countries in South America in connection with the mortality rates. There is an increase, but it is not dramatic or drastic as the one that we see in other countries. But in Colombia, there is a need to expand access to primary health care because the rates of subdiagnosis and and undertreatment or insufficient treatment are more significant than in other countries. So this is a call to increase the number of individuals that receive treatment due to cancer, diabetes, and they do need diagnosis and screening. And also, I'd like to call your attention to the report because Colombia is one of the countries that is mentioned, and the impact on the economy is high as compared to other countries in the area. So almost $1 billion. That is the economic impact that we see. So this is a case for higher investment in prevention, but also in primary health care to prevent these early premature deaths. Thank you very much, Silvana. Now I give the floor to Dr. Barbosa for the closing remarks. Thank you. Thank you very much, Ashley. First of all, I would like to thank the researchers for providing such a detailed report based on the best available evidence, such as we heard here. This is data that is publicly available, but here we see an analysis that could be used as a call to action and also to pull attention towards the situation. The impact of NCDs is unacceptable because of how detrimental they are to families, health, and communities. We do have the tools to stop this process, as we have already heard at some point during this press briefing. We do have some tools that are being used in the region, but it is necessary to make more emphasis on this. We have tools to prevent the consumption of alcohol, the consumption of tobacco and sugary beverages, and also to increase information for people to buy more healthy food, and also to bring health care in cases of mental health issues, and also do this through primary health care. This is the best platform. This is the most cost-effective platform because it can better use the available resources to identify early a person who has diabetes, hypertension, or cancer in a situation in which we can still offer some alternatives, better alternatives for treatment and also for maintaining the better health situation. We need to change the current health situation. Unfortunately, for many individuals in the region, mainly the poorest, those who live in the most remote areas and individuals who live in vulnerable situations, the first time they learn that they have hypertension is when they have the first stroke or they have a heart attack or some of issue of that sort. So individuals in poor areas only find out that they have diabetes when they have problems with their vision, with their kidneys, or one of their limbs needs to be amputated. So this can be changed in a highly effective manner with a relatively low investment. We need to prepare primary care to offer early diagnosis and access to health. So I believe that we need to look at the findings in this report, and this is a call to action We are calling the attention to the issue, but we also have tools that can make us make important progress in this area. And also in the case of cervical cancer, this accounts for 44,000 deaths of women in the region, 44,000 families that lose their mothers, and oftentimes they lose the only adult who had an income in that family, and this is due to a disease that should be completely eliminated in the region. PAHO has a strategy to eliminate cervical cancer if we combine high coverage with the vaccine, HPV vaccine, that is almost available in almost 100% of the countries in the region, but we need to be more creative to find better strategies to get to girls, adolescents, and young women. This is part of the new strategies as part of primary health care to have better tools for diagnosis, for pre-cancer lesions, and also the treatment of those lesions. So we do believe that the Americas will be the first one to eliminate cervical cancer. We have the tools, and this is a compilation of all the tools and strategies that we have. And if we coordinate them properly and implement them properly in the countries, we can fully change the future of those individuals, those families, and those communities. So let us continue to work. Let us continue to support the countries so that we can better implement a response to non-communicable diseases with health promotion measures and also the strengthening of primary health care. I thank you all for being with us today. We have come to the end of this press briefing today. I would like to thank Dr. Barbosa and also all of our panel members. I would also like to thank the journalists for their participation and also for contributing to this issue. You can continue to send us your questions and requests for interviews through mediateam@paho.org. And we shall see you soon in the next press briefing. Thank you very much.